Homelessness, and we will begin with a pledge of allegiance, and I will turn to my good colleague on the right and ask if he would do us the honors.
Thank you very much, Mr. Chair. If you'll all please rise if you're able and place your right hand over your heart and repeat after me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, sir. All right, the agenda for today contains a brief description of each item to be considered, except as provided by law. No action shall be taken on any item not appearing on the agenda. The Commission End Homelessness encourages public participation. If you wish to speak on any item appearing on the agenda or during general public comments, please complete a speaker request form and turn it in to the clerk prior to the reading of the item. Speakers will be given 3 minutes to speak. The clerk will run the timer and announce when your time is up. Public comment may also be submitted electronically by emailing response@ocgov.com. With that, we will move on to the roll. Madam Clerk, if you would call the roll.
Thank you. Please indicate your presence when I call your name. Commissioner Sarmiento,
Here.
Commissioner Wagner,
Here.
Commissioner Vanderpool,
Here.
Commissioner Rose. Here. Commissioner Parks. Here. Commissioner Dunn. Commissioner Dimitropoulos. Commissioner Cornwall. Here. Commissioner Davis. Here. Commissioner Twan.
Here.
Commissioner Ivins.
Here.
Commissioner Spitzer.
Here.
Commissioner Searcy.
Here.
Commissioner Fabry.
Here.
Commissioner Wyatt.
Here.
Commissioner Peineman. Commissioner Rios Faust. Here. And Commissioner Morse.
Here.
Thank you, Chairman. We have a quorum.
Thank you very much and welcome all. Thank you all for being here today. And quick housekeeping item. As a reminder, please be aware that the room is hot mic'd for the live stream of the meeting. Please try to keep side conversations to a minimum as they may be picked up by the microphones throughout the room. All right, we will now move to the agenda for today and begin with our discussion items. Madam Clerk, will you please read the first item?
Yes, item 1 is the Office of Care Coordination update, which includes updates on membership, coordination with federal partners, and the 2023 homeless survey. And we have no request from the public to speak on the item.
All right, thank you. And let me first welcome our newest member, Captain Ivins, to the Commission End Homelessness. And I'm looking forward to working with you, and I'm sure we all are looking forward to it. Although not joining us today, I'd also like to take a moment to thank Nissan Kisten for his service on the commission, and understand he is moving off of the commission. So good luck to him and the Salvation Army in all of his future endeavors. All right, Mr. Becht, item 1.
Yeah, thank you, Mr. Chairman. So good afternoon, everyone. Thanks again for coming and joining us for another commission meeting. I'll really briefly reiterate what the chairman said. We are excited to have Captain Ivins here for his first meeting on the commission. As you know, he's replacing Captain Adrian Fellows. And Captain Ivins oversees the Sheriff's Department's Behavioral Health Bureau, which include overseeing ATFB's homeless liaison officers. And we're excited to have Captain Ivins on the commission, bringing his experience and expertise. And want to give him a second to say hello, introduce himself. And thank you so much. And on the flip side, like the chairman mentioned, Major Nursan Kisten has been recently promoted at Salvation Army, which requires him to move to Denver. So unfortunately, he'll be moving off of the commission. We appreciate his time. And unfortunately, the Salvation Army has him going up to Alaska at the moment, so he's unable to attend. All right. So on May 24th, the county, led by Chairman Wagner and Supervisor Sarmiento, hosted a meeting with a group of regional leaders from several different federal departments. Helene Schneider, the senior regional advisor covering the state of California for U.S. Interagency Council on Homelessness, helped gather local leaders from the VA, HUD, Social Security Administration, and SAMHSA. On the county side, representation at the meeting obviously included the supervisors and top leadership from the CEO's office, HCA, SSA, and OCCR. This is really the first time a group of this composition got together. And we, the county, used this as an opportunity to present on the robust and balanced system of care that has been developed over the past 7 or 8 years, while also highlighting a handful of key initiatives going on here in the county. It also allowed us to showcase how we have implemented many of the key strategies identified in the federal government's all-in strategic plan, and how we've also started to see some of the results that plan has anticipated happening when investing in those strategies. So speaking of the all-in plan, on the federal side of it, Helene and her colleagues used the meeting to present on the all-in plan, which is a federal strategic plan to prevent and end homelessness. This was published by the U.S. Interagency Council on the Homeless back in December. U.S. Interagency Council on Homelessness, USICH, is the federal department responsible for coordinating efforts around homelessness throughout the 19 federal agencies that partner in such efforts. The all-in plan sets a bold goal of reducing homelessness by 25% nationally by 2025, and ultimately build a country where every person has a safe and affordable home. It's comprised of 6 pillars, categorized in either foundational pillars or solutions pillars. Foundational pillars are 1, leading with equity, so it highlights strategies to address racial and other disparities among people experiencing homelessness. Second pillar is the use of data and evidence to make decisions, so strategies to ground action in research, quantitative and qualitative data, and the perspective of people who have experienced homelessness. And its final foundational pillar is collaboration at all levels. So strategies to break through silos between federal, state, local, tribal, and territorial governments, as well as organizations, public, private, and philanthropic. And lastly, including people, incorporating people with lived experience. The 3 solution pillars are scaling housing and supports that meet the demand, so strategies to increase the supply of and access to safe, affordable, and accessible housing, which is tailored to support the people who are at risk or experiencing homelessness. Second pillar is improving effectiveness of the homeless response system, so strategies to help respond, to create a response system that meets the urgency of the crisis. And then third is around prevention, preventing homelessness, so strategies to reduce the risk of housing instability for households most likely to experience homelessness. Helene also presented on the all-in, what they call all-inside, which is a key part of all-in. All-inside is a first of its kind initiative to address unsheltered homelessness across the country. It focuses efforts in 6 communities, Chicago, Dallas, LA, the Phoenix metro area, Seattle, and then the entire state of California. The goal is to accelerate ongoing efforts by local leaders. The Biden-Harris administration will offer innovative and tailored support to participating community for up to 2 years, which includes embedding a dedicated federal official in each community, developing a dedicated team across federal government to identify opportunities for regulatory relief and flexibility, navigate federal funding streams, and facilitate a peer learning network across communities. And then finally, All Inside seeks to convene private sector and other communities to identify opportunities, follow up on support and collaboration. In addition, the administration will launch new efforts to address major barriers to housing, healthcare, and other supports for people with students in the community. So overall, the meeting is a great opportunity for us to strengthen our relationship with our federal partners, ensure that the conditions and work going on related to homelessness in Orange County are understood and being considered at the federal level, as well as an opportunity to ensure that we are leveraging federal resources throughout our system. And lastly, for my update, I want to provide an update on where we are with our 2023 homeless survey. So the month of May was a big success in that we/CityNet was able to collect the desired 612 surveys throughout Orange County. We heard from CityNet staff that it appeared that they didn't experience any challenges related to the length of the survey and that all questions, they didn't have a single question that they felt like didn't hit with the audience, or they weren't getting the information that the survey was intending to seek. CityNet and our office were able to meet with the commission's ad hoc group that will be looking at the results and providing a summary and policy recommendations in the near future. We were able to get that group together on May 22nd to update that group on the progress of collecting surveys, and then start the strategic discussions around how we will analyze and go about our task of looking at the results. As you can imagine, CityNet needs some time to complete all, to compile all of the surveys and share the results. We're anticipating, in terms of a timeline for the commission, we're anticipating that CityNet will be able to hand over to the ad hoc group the raw data probably by the beginning of next month, later this month, possibly. And then the ad hoc group, we've already scheduled several meetings throughout the summer to analyze that data and to work on preparing something to come back to the commission. We anticipate being able to share the results and the potential policy recommendations at one of the commission meetings, either in the late fall or early winter. As part of the exercise that the ad hoc will be undertaking, we'll be looking at results of our survey and comparing them with potentially comparable surveys done throughout this community, throughout the state, and nationally. Which provides me with a good segue to mention one of the potential comparable studies, and sort of timely. So some of you may be aware of the study that UC San Francisco released earlier this week that's been making its way through the local media. It's called California's Statewide Study of People Experiencing Homelessness. The study surveyed nearly 3,200 people experiencing homelessness throughout the state, to better understand how people have become homeless. What are their experiences? What are the experiences that they've experienced while homeless, and what is preventing them from exiting homelessness? So driving at some of the points that our survey has questioned, but not all of them. Since a handful of you have, I've had a discussion the last couple of days with a handful of you about this study, we thought it was important to include, might as well include the executive summary in the packet that you guys have here today. I want to be clear, this is just, this is more of an informational pass along, and we will be considering, we'll most likely be comparing our study and our findings to some of the stuff in here. I would like to point out, since since we're on the topic, there are a few things that I think are interesting about the findings, and I won't go into great detail, but there are a handful of things that the media has been highlighting, and then a couple of things that I found in the executive summary that I hadn't heard through the media, but I think important for this group to know. So a lot of you probably have heard that the study found that 90% of the people that they surveyed are from the state of California originally. And actually 75% of the folks they surveyed are from the county in which they surveyed they're experiencing homelessness, which lines up fairly well to what we see here and what reports back in our point in time count. You know, a couple of the other things that are worth noting is that even, you know, the media's been picking up that folks believe that if they had an additional $300 to $500 a month, and you know, I know we're going to have a presentation by United Way in a few minutes about prevention, but even if folks had an extra $300 to $500 a month, they felt like that would help prevent their homelessness. And I think that's an important point, but more importantly, you know, I think it was interesting what I saw was even if the causes of homelessness had many factors, participants really believed that financial support could have helped prevent their homelessness. So sort of recognizing that it has many different factors. And then the last thing I'll point out, I don't want to, you know, spoil everything, but I thought the other thing that's really interesting was that a large percentage of folks said that if they were offered shelter, they would take it. And I think that's one of the things that we're looking at with our survey, which is trying to understand, you know, we've done a lot of work here in our community, and we have a lot of resources, and the folks still out there, what's going on with the folks still out there? How do we get those individuals engaged? So the executive summaries here in the, you know, in your packet, feel free to read it. I'm sure we'll reference it in future meetings. And with that, I think that ends my update, and I'll hand the floor back over to the chairman.
Thank you. Real quickly, I want to thank Doug and Zaleem and the entire team. The meeting with the federal partners was quite interesting as far as I could see. There are really two main takeaways I had. And one was the overwhelmingly positive response, what we are doing received from those federal folks. There were really no questions like, well, why are you doing it that way? And how about doing this and whatnot? It was very collaborative. And I think a testament to the team here and the work that they've been doing out in Orange County, that the overwhelming response from our federal partners was great. Here's what we can do to supplement it. Here's how we're helping. Here's, you know, our process, et cetera, to make it smoother. The second thing that was a real surprise to me is that they said this was the first time many of them on the federal side had actually even met each other, which struck me as odd that they could all be in this business collectively. And this is the first time, but good on us, Doug and his team, putting this together and making sure that not just are we at the table, but it sounds like we provided the first table for some of these people. And so hopefully, I don't say this often with government, hopefully this really was a good collaborative effort and the start of many more such efforts. So Doug gave you the nuts and bolts of it, but that was my takeaway. Those were my takeaways from it. So thank you guys for that. All right. Anybody else on anything that Mr. Beck had to say? Sir.
You know, I'll just dovetail onto what the chairman said. Yeah, they don't hang out as closely as the chairman. So they need to get together more often, because yeah, it was stunning to see that people on that side of the table were looking at their counterparts saying, oh, we never met. And so I think hopefully that's something that we prove that we do have our, you know, agencies working together, city, county, departments. But one of the things I wanted to just mention, dovetail onto what Doug was talking about with respect to the study that was done. What was interesting to me, and one of the takeaways I think that I, after reading the study, found was that I guess we have this sort of preconceived notion of what a homeless person is, where they come from. And I think a lot of us, and I had this sort of view that they were coming from the outside. They are getting out from our state. Secondly is, you know, we think that what causes homelessness may be, you know, either a chronic mental illness, whether it's substance abuse, but it looks like a lot of this is economic, right? So many people just, said in response to the survey was literally whether it was a catastrophic injury, a job loss, or rent increase, that's what triggered the homelessness, which I think then puts them in a space to be preyed upon by others who will give them those substances to sort of self-medicate. So that's what the sort of the theme, as I saw it, working through it. We want to look at it closer because it does give us a view of the state. We can go ahead and kind of funnel it down to see what that says about the county and how we're doing things. But it was interesting to me that many of the causes that people responded to this survey had to do with just economic conditions, which shouldn't be a shock to us. But it's not all that folks are just mentally ill or abusing substances. I think those are consequences of being unhoused, but it really does show that some people are a paycheck away, or one injury away, or one dismissal away from work from becoming unhoused. So that was it was an interesting study, but more to follow.
All right, anyone else? I see no one. All right, that's not an action item, and so we will move now to item 2. Madam Clerk, you better read item 2.
Yes, item 2 is a presentation titled Orange County Evictions, a landscape analysis of rent-based evictions and housing instability in our communities. We have no request from the public to speak on this item.
Thank you. And in previous meetings, folks at this table have expressed an interest in prevention and focusing efforts upstream to limit the number of people who experience homelessness here in Orange County. So we have with us today Michelle Murphy from OC United Way, who will be sharing the findings of the study commissioned by OC United Way to understand evictions in Orange County. And Commissioner Parks, if you'd like to do a quick introduction.
Thank you. I appreciate it. Thank you for having us have this discussion today. We're looking forward to sharing some of the things that we learned in this research. I did want to start off by framing this a little bit. And just so you know, I think everybody knows we're Orange County United Way, but we're part of a network of United Ways. And the United Ways of California does research every 2 years on the what they call the real cost measure. What does it really cost to live in California? And they break it down by communities all up and down the state. And they just released it just a couple of weeks ago. And we'll do a deep dive in this data next month, and we'll share any more detail. But it plays in beautifully to what Commissioner Sarmiento was saying in terms of the cost of living here. So just so you know, this is very current data that for a family of 4, 2 adults, 1 preschooler, 1 school-age child, a household income would need to be close to $110,000 for them to live without assistance. So this includes things such as their cost of housing, childcare, food, transportation, healthcare, and taxes. The official poverty measure, just as a reminder, was based off of food costs that was inflated every year. Didn't include housing and healthcare and all the other costs the family needs to go. So I want to put that perspective out just as a grounding of why this topic of, the challenge to what happens if somebody misses one paycheck can do to a family. So again, just a little grounding. So again, this is other information. We'll have more detail in this if you'd like to learn more about this study. But it shows that households of color are disproportionately impacted. Households with young children. And if you think about it, if that's a household income, so if there's one earner and trying to manage a family, very, very challenging for them to get by. And I think you'll see this play out in the eviction data that's based on rent. And again, you can read all of the different data, but we wanted to just frame it with some current research that was done specifically about Orange County. So the next slide, I just wanted to remind everybody, if we could go back, and this dovetails beautifully into the study, the research that was just done by the University of California, San Francisco. When we had Jamboree and Orange County United Way Commission, the cost study that you'll all remember back in 2017, it highlighted the 3 top issues of why people in Orange County became homeless. And number 1 was securing or retaining jobs with sustainable wages. So again, if you think about what I just presented, that correlation. Finding affordable housing, And the 3 family issues, which again, if a family's divorced, if there's domestic violence, somebody falls ill. Challenge because they miss that paycheck and it gets into a spiral and it's really hard to recover. So that's just background information. We thought that the study that came out earlier this week really validated a lot of the research that was done here locally. And I'll look forward to seeing how it correlates with the research that was just done. But it's exactly, the type of things that we're focused on at Orange County United Way. And we were so fortunate to have Providence step up and say they want to learn more. So to take it from here, let me introduce our Senior Director of Public Affairs, Michelle Murphy, who's going to take us through the research that we did recently on rent-based evictions here in Orange County. So Michelle.
Everyone, it's nice to see you all, lots of friends. I will just clarify that I did not perform the data. I did not do the analysis, so you are unfortunately stuck with me. Our data expert is up in Oregon, Kari Parsons. She was unfortunately not able to make it down here, so I can't answer technical questions on the data collection necessarily, but I'm happy to share what we, most of the findings that we were able to glean from OC courts and our surveys and our data collection across the county. This was essentially what we set out to figure out, to find out. Providence, as I mentioned, did come to us after the emergency rental assistance program was coming to an end. They saw the benefit of those funds going out to folks during COVID to keep them housed, to make sure people could continue to pay their rent. And they wanted to know, what did the eviction landscape look like in Orange County? Was it significant? Is it something we should be worried about? Providence, from their own community health needs assessments, we're starting to see that not only were there patients having housing insecurity and housing instability issues, but their employees were as well. And I checked with Christy before I shared that point, but they were starting to see housing become one of the #1 issues in their community health needs assessment. So they asked us to do a deeper dive, and we did. I will say it was a little tough going because OC Courts has never shared this data before. They have never released the eviction data to any organization, and they felt comfortable releasing the information to Orange County United Way. They felt that we could be safe keepers of the data and we wouldn't sensationalize it or make something out of it that it wasn't. And so one of the first things we looked at was the renting households. And in Orange County, we do have a higher number of renting households than in the nationwide average, but a little bit less than the state average, which is 45%. Here you can see, as I said, we were taking a look at who's renting in Orange County. More OC households are renters, 43%, like I said, than the nationwide average of 36%. We wanted to understand what happens to these folks. And so we went and looked at the eviction rate for non-payment of rent. And I realized during the moratorium, people said to us, no one's being evicted, but there was actually ways that you could get around the moratorium and evict folks during COVID. And so we wanted to focus on non-payment of rent for evictions to really understand the renting context and eviction rate in Orange County. This map tracks the 69%, many census tracts are more than 69% renter occupied. We took a look at the map to see where the renters are. This map is not necessarily different than any of the maps that you've seen around the high need levels in the county. It tracks with kind of the OC indicators reports with some of the other reports that come out about the county. So this didn't show us anything different. At the city level, Midway City, 72% of the renters of the city are renters. Costa Mesa, 59% of the city are renters. Irvine, 55%. There's 444,000 renter households in the county. 1.34 million people live in rental housing in the county.
Thank you. You want to wait till the end for questions?
I was assuming we would wait till the end, but if you've got something burning.
It's not really burning. I just want to know what the relevancy is. Who cares where they live? I mean, how is that data of the highest rental cities utilized then in any extrapolations? What's the relevance?
Just in taking a look at the renting landscape, where are the renters primarily located?
It doesn't, but the study didn't necessarily conclude. There's nowhere where you said higher renting areas have more risk of more evictions. There's no, is there a correlation that was derived in the study?
Well, it became actually more of a correlation. If you are very low income and you are highly rent burdened, then you had a higher risk of eviction. Yes.
But it's not necessarily Irvine has probably the highest rents in the county. Do they have the highest eviction rate?
Unfortunately, during COVID, yes, they did.
Because of income? Or
No,
lost jobs?
probably more because it's a community that has it's more corporate owned apartment and landlord owners. So they were able to figure out how to get someone evicted. But when we added additional eviction data past the moratorium, Irvine kind of slipped back down into the middle of the pack and the cities with the highest eviction rates.
What, just one last thing that's now burning as a result of that answer. We have engaged in the courts on risk assessment models that the courts were doing because the legislature said you have to do it now. And they did their data during the pandemic. And it's all misleading and grossly disparate, and you cannot draw any conclusions. Judicial counsel had to admit that. In this context, is during the pandemic the best time to study
No,
this?
and to your point, DA Spitzer,
You can call me Tom.
thanks, Todd. We've met many times. So
I
thank
know
you. So no, I will say the punchline of all of this, just so you know, is really about Orange County does not have a high eviction rate. When you go through this data, it's not some crazy eviction rate. Actually, the state of California does not have some crazy, really high eviction rate. The state has done a lot to make sure that tenants are protected. So let's just put that out there. But what this study does show, this is punchline. I mean, I can skip the rest of the slides, but the punchline really is we have a significant portion of the population, about 1 in 5, that are overly rent burdened and very low income. And those are the ones that end up sliding faster into homelessness. So if we as a community really want to take a look at the population to focus on to make sure that they don't become homeless, it is that highly rent burdened, very low income population. It's not rocket science. It's not, you know, we're not presenting you something that you would necessarily probably not be able to come to your own conclusion on. But when we took a look at the data, to me, this is what really spoke as the issue. It's a small enough population, it's about 83,000 people, that we could really try and help. It speaks directly to what the San Francisco study said, is this is not a huge like a huge group of people that need a tremendous amount of help. They need a little bit of help to get past whatever that hurdle was where they couldn't make that one rent payment. And so that's what I think Orange County could really, we could stem that tide into homelessness. We can stop people from doing it. We don't have a massive problem. We have a problem that is solvable. The courts want to work with us. They've been very generous, like I said, with the data. They've been very generous with trying to figure out with us, what more can we do on the mediation side? What more can we do to explain to renters what the process is so that they, you know, maybe show up to court and to talk to the mediator as opposed to just walking in, you know, off the streets and being scared as anyone would walking into court with an eviction notice. So they've been wonderful to work with. I think the best thing about our county and our community is we are small enough and close enough that we can work together. We can all be partners together. So this, like I said, this data, I got a notice from CAA and in the apartment association. They were not thrilled with this report, as you can imagine, with this data collection. And I told them, from my perspective, this data is not, we're not landing the land. Irvine companies can work with us on our eviction pilot program in the city of Irvine. What we're saying here is this is a solvable problem and we need more affordable housing and we need to help those at most risk. And that's it. That's what we want this study to really highlight and talk about.
Commissioner Sarietta.
Yes.
Thank you, Chair. And thanks, Michelle. I think, what's interesting is I always feel like more data is better than less. So if that slide wouldn't have been there of where the concentration of renters are in our county, probably would have been a question we would have asked, like, where are they? Right?
I did debate putting it in. So if you're, if I'm gonna be honest.
Empirically, I think all of us kind of know where there is, where their concentration is, but I just think findings and data and research is always helpful to decision making. So to the
To
extent.
know kind of where the renters were, where this.
And so that way, because when it comes to resources and nexus to solutions, some of it's geographic and some of it, has to do with, what areas of our county are more impacted so we can concentrate services there, or at least try to identify maybe is there a correlation to something else, right? Is there, is it in cities that have more density? Whatever the case is, I just think, to the commissioner's question, what relevance does it have? Maybe not a lot, obviously, but to the extent that we have to factor it in as knowing where these folks are who are impacted and probably more at risk is good to know, and is good to know to have, some idea of where our folks are.
Well, all right, all right, but you've raised it, and thank you to Commissioner Spitzer for bringing this up. We've got to keep in mind, one of the reasons the apartment association might have had a problem is with the data is not that the data is wrong or anything. It does suggest that, okay, it's the landlords that are the problem. They are pushing people into homelessness, and if they would only just suck it up like they were forced to do through COVID, we wouldn't have this problem. And I'm hoping as we go through the slides, that is not, and I don't think that is your takeaway, but at the end of the day, that's an idea that is out there, and Sacramento is pushing. It's like, if you can afford to own an apartment building, well, then you can be the one who absorbs that high cost of living we were talking about. You're the one that is at fault when somebody loses. And maybe they're saying, if we're going to try to find solutions, they need to be a part of it, not as the problem.
Absolutely. I think that's what we're going to get to when we go through. Maybe we could go through.
Okay, go ahead.
I would absolutely
Continue.
agree with you, Chairman, and also add that during the ERA program, we talked to a lot of and worked hard, and we're also in positions where if they didn't get the rent from us, they were going to have problems with owning, with their ownership of their property. So no, they are definitely not the devil here. Okay. And I'm just glad, Todd, that wasn't a deep question on data collection that I was not going to be able to
I
answer.
wouldn't do that too.
Okay, thank you. So here we go. Higher housing insecurity is also shown in north central areas of Orange County. This is showing the PUMA areas, the public use microdata areas, which are defined by the Census Bureau. This is showing again Westminster, Stanton, Garden Grove, all within PUMAs with the highest rates of renter housing insecurity, ranging from 26 to 29% of all renting households. Again, like I said, these maps are not showing us anything that we haven't seen before in our work in the county. We took a look at who the renters are. That was also a key question. We wanted to know who was renting. There's more diversity among the renting households than we realized. Since research finds that neighborhoods with more renters of color tend to face higher eviction rates, we wanted to understand the demographics of the renting population in Orange County and how that differs from the owner population. What we find is that in general, there is more race, ethnic diversity in the renting population. The renter population has a higher proportion of Latino, Black, mixed race, or some other race alone householders than the owner population, while the owner population has a higher proportion of white, Asian, or non-Hispanic householders. Again, this is not I'm sure news to most of us. Black, multiracial, and Latino renters experience disproportionately higher pandemic-induced housing insecurity. Again, this is not new news to you. We looked at the Emergency Rental Assistance Program, ERAs, I've mentioned several times, as data proxy for people experiencing housing insecurity, the green bars. We compare that to the overall renting population, the black bars. As this chart shows here, when compared to the proportion among the renting population, ERAP recipients were disproportionately Black, multiracial, Latino. The disparities were particularly extreme for Black residents, where 9% of ERAP recipients were Black, but only 3% of renting households have a Black householder. This again goes into the Black, Asian American, Indian, Pacific Islander, and Latino households at disproportionately higher rates compared to the proportion of the renting population. We also looked, like I said, at rent-based evictions. Again, we get that the years were not great, 2020 from 2022. Providence was looking to see this information at a particular place and time. So we weren't in a position to ask them to wait a couple of years, though we might be able to revisit this data and take a look at it without the moratorium or COVID existing. Let's see. One of the barriers, like I said, was getting the data on rent-based evictions. Unfortunately, the data did not distinguish between rent-based and non-rent-based evictions before February and March of 2020. This research was focused on evictions for non-payment of rent. This data doesn't show non-rent-based evictions such as lease violations. So just to be clear, again, this is all about rent-based evictions, not people who broke their lease or had other issues that they had to be, that they were evicted for. There were a handful of rent-based evictions during the period when the moratorium was in effect. Without going into details, which I wouldn't have normally gone into that detail about Irvine Company, there were limited circumstances that allowed for rent-based evictions during the moratorium. And I will say Irvine Company was one of the landlords that we worked with very closely in Irvine, who was very helpful during ERA. The eviction data reflects unlawful detainers filed in the court after a notice to pay or quit has been given to a tenant and the tenant does not pay or quit. Note that circumstances where a landlord issues a notice and the tenant moves out would not be captured in this data. However, many of you in the room told us, and this was originally shown to the entire Eviction Diversion Collaborative in April in the city of Irvine. They hosted the event with us. We brought in all the service providers, we brought in landlords, we brought in all of our partners on this project. And they said that the research corroborates that this type of informal eviction where someone is given the notice and just moves out and this does not move into the court system is very common, particularly among undocumented households that do not want to interact with the court system. So this data is not reflective of those people who just voluntarily move out and don't go through the court system. Lots of people asked us several times, how do we get that data? Could we get that data? People who involuntarily or voluntarily self-evict, and without sitting in everyone's apartment, there's probably no way to really know. We're making guesstimates that this number is high. We can only assume that the formal eviction rate is an undercount in the issue of losing one's housing. So as you can see, the moratorium, this is a chart of rent-based eviction filings in Orange County from 2020 to 2022, and the case status as of March 7th, 2023. This chart shows rent-based eviction filings, the gray bar, in the month the case was filed, and then the status of that case as of March 7th. So for example, a case could have been filed in May of 2022, but not decided until July. That case would always show up in the data in May, but its status would change from pending to either dismissed eviction or in favor of the defendant. As you can see, the moratorium largely kept evictions in check from 2020 and 2021, but as the moratorium expired in early 22, the number of filings peaked and then begins to fall again. Data from January and February of 2023 suggests that the number of filings is continuing to fall, with 254 filings in January and 315 in February. We have not been able to get more data past February, but in conversations with the courts, it's continuing to drop and level off and go back to more of, it's not pre-pandemic levels, it's still a little elevated, but about the same. Next, over 3,000 rent-based evictions in 2022 with 842 cases pending. So this is a summary of the chart showing 3,052 rent-based evictions in 2022, which is equivalent to 0.67% of renting households. So far, for cases filed in 2022, landlords had a 60% success rate. This is what we talked a lot about with the courts. Todd, is unfortunately, and we actually sat, I went and sat in eviction court for a day. Our staff did. We saw how the courts are fair, how there is, they don't take, one side over the other. They offer everyone who comes into eviction court the opportunity to meet with a mediator. But for the most part, the folks who came in did not have lawyer representation, and the landlord for the most part usually did. And so the success rate on the evictions really does fall on the landlord side. They have a 60% success rate. Compared to 0.12% success rate for tenants. 23% of cases were dismissed, which means the landlord did not show up in court or the parties agreed to settle the case by agreeing to a move out date or the tenant paying back rent. As of March 7th, 2023, 17% of cases filed in 2022 were still pending. If the landlord success rate continues, then we can assume that approximately 500 of these pending cases will end in eviction.
Michelle, before you leave that, Mr. Chair, do we know how many of those on the rate had the benefit of counsel and those went in brokers?
No, we don't, because that is not tracked with the OC court data necessarily.
I mean, maybe they don't give it to you, but for sure that the minutes, it'll say who's representing who. It has to.
Oh, yes, maybe in the minutes, but when we were just trying to get straight data.
I understand. They can give you that data.
And sort of the point of it is that, those that are in pro per, in other words, representing themselves, which is probably likely for many of the of those facing, an unlawful detainer action against them, are probably going to be very unsuccessful at pleading their case, because more than likely the landlord will have the benefit of counsel being able to explain, again, properly, procedurally correct arguments. So that's something I think to me that is also telling.
Very actionable. That's one of the things that we.
How's that actionable? We're going to provide counsel to everybody who's sued to leave their apartment.
We talked to the courts about bringing in more mediation, getting ahead of it, so before it gets to the point, we like to get ahead of it, right? Because we want, at the end of the day, when somebody ends up in eviction court, so how do we help bring more support to the system?
There was apparently, I guess, pre-pandemic at the state level, they were looking at paraprofessionals to come in and be more available to help tenants get through that process. We're talking with OC courts and can certainly talk with the state a little bit more about bringing that idea back and how that might be able to help. The mediation process, for the most part, as we saw it, is really just an opportunity for the tenant to not have an eviction on their record, but it almost 100% and the tenant moving out and the eviction notice receipt rose sharply among 211 OC service contacts after the moratorium ended. This just is showing how many people started calling 211 with an eviction notice. Since June of 2022 to May of 23, 211 has had 248 contacts with people calling in saying that they had an eviction notice. So it's a little bit lower than right after the moratorium ended, but kind of staying where we thought it was at. Capacity to meet demand. We went and also talked to the service provider, everyone who helps these tenants try to get through that eviction process. What happens when you call 211 and get referred to an agency who might be able to help you? So this basically is showing on the on the voucher side, that we have a little bit of a problem with the rental assistance as well. Rental subsidies are key strategy to diverting families from losing their housing. Orange County is served by 4 housing authorities, which among other programs operate the Housing Choice Voucher Program, or commonly referred to as Section 8. This program offers long-term housing stability by providing rental subsidies for recipients to use to rent housing in the private market. As shown in the chart, over the past 5 years, roughly 23,000 households have benefited from this program, yet over 33,000 are currently on a waiting list for a voucher. This figure is likely much larger since the housing authorities close their waiting lists and the number of the lists dwindle over the time due to attrition. When the housing authorities last opened their list, they received applications from 92,698 households. So like I said, we were looking at service delivery. How can they help? Housing vouchers is one of them. We all know that, but there is a long waiting list for those. We talked to the service providers. About 50% of them said they were able to support or they were able to help about 50% of the callers who called in for help. So the service providers are also having capacity issues. They're not able to help as many people as they would like to help. I will get going here. Like I said, the service landscape. 71% of the eviction diversion rental assistance provided in 2021 relied on pandemic-related funding streams for most or all of that rental assistance, and 22% of legal services and counseling relied mostly or entirely on pandemic. So this last little bit, like I said, about the service providers, we wanted to know, is there capacity? When we talked to 211 and they're referring people to other agencies, are the agencies able to help them? About 50% of them are not. So because they have their own capacity issues. So when I look at all of this data, and on the last slide here, hold on. With 10,090 households provided with emergency rental assistance to keep them in their existing housing during the ERAP, 3,400 households provided with eviction diversion and legal services. This is not, like I said, a huge number. This is not an insurmountable problem. From our perspective, the rental assistance for the most rent burdened and low income would be our best tool to stemming the tide of folks into homelessness. It is, like I said, not a huge number. At the 83,000 in the county that are severely rent burdened with very low income are people that we can help if we target those dollars effectively, efficiently. I think collectively, if we come together. One of the best parts about ERA, I know ERA program got a lot of complaints during the process. COVID was not fun. I know a lot of people sat at home and like rearranged their garages or whatever, but we were working 24/7. And I will say that getting that money out to people who needed it most was very gratifying. We kept a lot of people housed. We stemmed the tide of homelessness. And one of the ways we did it is was working together. Doug came up with a system to have the calls come into 211, to have people immediately screened for eligibility for that program, and then sent on to a service provider who could help them, who had the capacity to help them. I think if we wanted to continue to do that type of work, albeit with much fewer dollars to a very targeted population, we could do it. And that's that.
All right. Thank you very much. Let's come back to the commission. Questions?
Thanks to Providence, I got your logo up there, Christina.
Questions, comments, anybody? Anything we haven't touched on already?
Slide, can we go to the slide that has the graph post-COVID, post-moratorium evictions? That one, yeah. So what is that saying? Because it's very short in time, right? So it looks like once the pandemic, the moratorium on evictions was lifted, there was a huge number of evictions, not huge, 269 or whatever.
It's not, like I said,
Not
it's not huge.
but they were pending, whatever. What were the reasons for those? Were those failure to pay rent 100%?
Yes,
So the only reason those people were evicted was failure to pay rent, and those were all pending during COVID because no one could evict.
they can, yes.
Okay.
They had to, there was some technical ways you could get it within the moratorium. Not a lot of landlords chose to do that.
And is there a distinction in our county between apartment association owners, I'm not saying they're mom and pop, because there are some big people in that who own multiples, but they're not Don Brent. So how would you characterize corporate ownership of and landlords vis-a-vis the Irvine company as opposed to individuals who this is their retirement?
It's tough. It's tough. In the Irvine pilot, for instance, so the city had some COVID dollars left over and they wanted to continue that work. They have a very small percentage of their population that needs rental assistance, but they are actively trying to make sure that they don't. So they asked us to put together a pilot. We're doing it the way we did it with ERA, with 211 and service providers who are going to continue to offer case management, financial stability classes, that kind of stuff. But we're working with the Irvine company because one of the things we wanted to look at is, could they help us identify people who are right on the cusp? Did they miss 1 or 2 payments? Could they tell us in advance who they are before they're even served that notice, so that we could then help them with rental assistance? We're not going to be able to do that for everybody in the city of Irvine, but if we have that eligibility really targeted to that group that we know is at most risk of becoming homeless, I think we could make it work. So Irvine company is very happy to do that with us. They want to do it with us. The landlords, like you've pointed out, and we certainly worked with during ERA, who this is their income, that was not as easy for them. And we really had to get those dollars to them quickly. They are not in as an easy position as an Irvine company to, maybe let a couple of months of rent slide. No.
Yeah, that could be pretty disparate for somebody who this is their retirement asset, right?
Yeah.
And this is how they live. And now their income's been dried up or whatever.
But they were also very easy to work with during ERA in terms of they felt for their tenants. They knew their tenants were in a bad position and they did not want to evict.
So 2 things. First, to sort of, I want to point out just sort of briefly about the ERA program. We here in the county made a real conscious decision early on when we developed our ERA program to not ask landlords to have to forgive rental arrears, that our program was going to pay as much as, our maximum of $10,000, but it didn't come at the cost where the landlord had to give up their income. Understanding the exact thing, that it's not only about ensuring the renter stays in the unit, but that the landlord, and a lot of these landlords were, as we know, landlords that owned 1 or 2 or 3 units. This was their retirement. This is, an important piece of their income, and they're paying mortgages off. That it was about also making the landlord whole as well. Shifting just a little bit, one of the things that it wasn't mentioned here, but it was mentioned in your study that I think is really important. It comes off of thinking about how much one needs to make in order to not rely on benefits. The study also looked at the type of households that were experiencing housing instability or potential eviction. And one of the things that I took away, and maybe you guys can speak on more, is that a very highly overrepresented group was single mothers that had single incomes, which would make sense when you're trying to reach a $110,000 threshold. And not only if you guys could speak a little bit more on that, but the reason I think that that's important is as we potentially as a commission and other groups, whether it's the county or cities or other groups, are thinking about how do we set up a program to help folks, as been mentioned before, really knowing how to best target those resources is incredibly important. And prevention is so difficult because you don't, if you've done a good enough job, you don't know what you've prevented. Using that research to do our best job at ensuring that the money goes to where it's going to have the greatest impact. And that's really, I think, for the commission, the court stuff's very important. I don't want to take away from that. But thinking about conversations that commissioners have both in this setting and outside of this setting, I thought that was interesting and impactful.
That to me is really the key point of the study. A very small percentage slight disability, whatever is going on, they're very low income and they're highly rent burdened. That's where those rental assistance dollars need to be targeted. That's how we can stop the stem of the flow of folks into homelessness. If we can reach those folks and make sure that they stay stably housed, we will have done our jobs. I don't know that we'll ever be able to prove it, like you said, because if they don't end up in a system somewhere, then we'll never know. But that is who we should be really looking at, that 83,000, that 1 in 5. That is the group we need to spend our resources and time and energy on.
And I think the other thing that's worth noting is, and remembering to distinguish, is that rental assistance is targeted to be time sensitive and time limited. I know we've heard before, and it happened to come up when we referenced the study earlier, that folks mentioned if they had ongoing financial support, that they believe that they could continue, that they would prevent their homelessness. So I think both can be true, but it's really important that we as a group and we as a system understand that there's two separate interventions here, often two separate groups that we're looking at. So it's when we're talking about usually a prevention program, we're talking about something that's time sensitive and time limited. And it's not all clumped into one. I know it's sort of splitting hairs here, but I think it's very important as we dive deeper into the topic.
Santa Ana, we are. Christine Judson is still friends with us. He was, very impressed with all the folks that we were able to help during, collectively during hearing. We're talking to the city of Anaheim, obviously working with the city of Irvine. How can we work together to really, because these dollars kind of go out sort of willy-nilly through various organizations, through various entities. How can we kind of work together to target that group, to really make sure that that group who is at most risk of becoming homeless don't? So I think it can be done. We're going to hopefully try.
Just lastly, what I'll say is that, Zulima appropriately pointed out, as we think about our pillar structure, what I'm trying to identify is this is we specifically define prevention, and so many, it was short-term intervention. That long-term ongoing assistance really fits more in that, in the housing pillar. So it's sort of a way for our group thinking in our framework, how they're separate discussions.
We're offering the case management as part of this program, so that someone can go to the financial coaching and the financial stability and maybe work on a budget. And that, as a participant in the Irvine program, they're going to have to go through those services for that long-term piece.
Thank you. Commissioner Parks, then Commissioner Sarmiento, then Commissioner Morris. Oh, okay.
Understand how they got that place, and all that needs to be part of that. That it can't just be financial. It's part of a strategy helps them stabilize and with capital. So case management.
Okay, thank you. Commissioner Sarmiento.
Yes, thank you, Chair, and thanks again, Michelle, for kind of wrapping it up. You did a great job, even though you're not a statistician. That's okay. But I think what I don't want to have get lost in this is that I don't think your study was intended to be punitive on anybody or to call out landlords bad, tenants good. That's not, I think, what the summary is. The story. Yeah. So, and Christine will correct me, because when I was mayor, we worked with a lot of very thoughtful, helpful, compassionate landlords that helped our renters stay housed. I will agree with Todd that, yeah, during, study having been done from 2020 to 22, probably a little bit more difficult than, sort of post-pandemic or pre-pandemic conditions. I think we still would find that there are, issues of housing, as renters. And we know that our county is almost, whether it's 43%, whether it's more or less, it's close to half, right, of folks that rent. And I think, the point of 60% of the households are headed by females who were evicted is important. 73% of those households who faced eviction were Latinos. Almost, well, more than 50% used 30% of their income towards rent, and close to 30% use more than half of their income on rent. That is a very destabilizing way to live. And I think it's a very volatile way to live, and I think it's a very dangerous way to live. So I don't think, I think the focus here is to talk about how we can kind of front end this solution, because once they're out on the street, unhoused, looking for some, remedy or resource, it's a lot more expensive than keeping somebody housed. So to the extent that, and it's better for the landlord, because to the extent we can find resources to make the landlord whole. And I think, Christine, when we were going through our ERAP, both 1 and 2, our landlords, really didn't complain. They might have complained on the timing, but they were always made whole with respect to any retroactive rents that were due to them. And I can speak to this from lived experience. I wouldn't have gone to college or law school had my parents not been able to have their multi-unit complex, filled with tenants that were responsible and being able to go ahead and make ends meet. So yeah, it was difficult for them, and they were, it was just a small number of units, but we were highly dependent on that resource, right? So to the extent we're sensitive, nobody wants to be harsh and say that a landlord should solve this issue. No, how do we? But I will tell you, in all honesty, there were some bad actors. There were some folks that, were very harsh on people that were renting and circumvented what the emergency order was and got people out just so they could spike rents on. That's the reality as well. I mean, so not everybody is a good actor. We have plenty more good actors than bad actors, but to the extent I think we have responsible people that want to help, I think that's an important thing for us to identify. But really, the idea here is that we have a pillar of prevention that I think we don't speak enough about, because as we try to house people and create shelters and brick and mortar units, the number of people that we have unhoused will just continue to increase, and we're never going to catch up with this. It takes so long to build up, brick and mortar housing. But to the extent we can keep people housed, at least we can keep things status quo or improve on that. But the numbers, it's just going to keep on increasing. And what I would suggest, Doug, is that, we're having the same conversation about prevention at Cal Optum, where I serve as a board member. I think, you all should reach out to them, because we, even though it's a health plan, we realize that part of health is being housed and looking at HIP money and looking at other monies that we have from the state. So to the extent we can collaborate and see what we can share with them as our findings here. But even though your study was done between 2020 and 2022, was it, or when was the state study was done after? And it says in essence the same thing. So it just fortifies, and I think it confirms what the findings were, both during and post pandemic. In any event, that's just a couple of comments I wanted to share.
Thank you.
I just keep going back to this.
Right.
All right, thank you. I've got Commissioner Morrison and Commissioner Wyatt.
In the post-pandemic era, do you have any numbers on how many people?
Not necessarily as part of the study, but obviously we all know that quite a few more folks.
Due to my going to city council, as I hear it, every city council meeting, it goes to me, so people calling on the city to start rent control because the rents keep on going up on them.
I will say, Bob, that not to divert the conversation, but in talking to David Victor from the Apartment Association and the California Apartment Association, I did tell them I would try to use this to advocate for more housing, more affordable and low income housing. So
Don't we all want that?
which they seem to like that argument.
Well, as Doug was talking about, he always does talk about that. I think in following up on this, we do need more work. Disagree with that. And every time we punish or appear to be punishing, we look against ourselves. So yes, there are factors in both sides. A lot of those, there's a huge percentage
that are owned by individuals that use it for, their source of income. So we want to make sure that we encourage them to do that, as opposed to make them feel like they're going to be, the source for funding people, who don't pay the rent. So anyway, we have to be careful on that side. But there's a couple of things. One, we've looked at a number of studies here at this commission over the period of time, including these things. And one of the actions as a commission, how do we start to take this data and make and figure out how to take action on it? Because there's a lot of actionable data that's been presented by the UCSF study and this study done and a couple other ones that we should start to look at it. Okay, we're chartered to advise the supervisors. How do we start to pull this data together and make some and take some advice out of it? So, and Doug, I'm just encouraging you to look at pulling some groups together or talking about how we make action, because there's a lot here to take action on. There's another thing that sort of struck me. I got on the prevention wagon early on because when I looked at the causes of homelessness and the percentage of people who became homeless versus the percentage of people who actually encountered those same problems, living paycheck to paycheck, substance abuse, mental health, only a very small fraction of those in that situation became homeless because the rest of them were surrounded by family and friends who could help, cover that for them, or community. There was an organization, they had a way where somebody would step in on their behalf and keep them out of the homelessness situation. And only those who didn't have that support system behind them ended up on the street generally. But then the problem I have, and I brought this up to Sue Parks some years ago in a conversation at Coffee Importers, you remember, I go, so how do we identify them, right? And she, kicked off a program about identifying them through our elementary schools, because staff and teachers, young kids often know those people who have an issue, and we kicked off some pilot programs that are now going. But what occurred to me as we listened today, the landlords also are early notices, and they're easy to reach because they're not in the, they're not the ones who feel like there's a stigma attached when one of their tenants is struggling to pay the rent. Where the tenant themselves doesn't always want to go out and make that, broadly public. But if we can work with landlords, starting with some of the bigger ones, but working our way down, and how we make these programs available through the landlords to be the early flags in prevention, because they've already, issued one, for example, one notice, and maybe there's a second one coming or whatever it is, but set some rules with them. We can start some programs where we can learn these early on. And I think most of the cases we look at, as Doug put it, that $500 a month for 6 months can often bridge that one crisis that put them on the street. I mean, that $3,000, to keep somebody from is a rounding error in what it costs to get them back off the street. So I think we could start to work our way as a commission through some ideas. If we took this data and we started to put it together, added the data that we've collected on our surveys and others to it to validate some of it. I think we don't want to pass up that opportunity.
All right, let me wrap this up. Thank you, Ms. Murphy. And let me add, Emmett, is what we're on prevention. Tie this and the earlier comment about just the cost of living in California together, and what a driver that is of homelessness. We take it for granted that it just costs a lot of money to build another housing unit in an affordable housing unit in California. And it does, but that's not the only way of creating affordable housing. If cost of living is such a driver of homelessness, maybe our prevention pillar ought to also advocate for things that reduce the cost of living, because an affordable house yesterday is not an affordable house tomorrow if, in the meantime, fuel prices have gone up because of bad government policies, and inflation is driving up the cost of food and other things because of bad government policies. And if you name the policy is driving up that cost of living, the affordability, availability inevitably declines. And so I throw out, maybe not for this discussion, but maybe later, do we add to the prevention a recognition that it's cost of living and there are policies that you may not think are homeless policies, but that might result in prevention if addressed. So I throw that out there. And again, Ms. Murphy and United Way, thank you, Sue, for that presentation. All right. Anything else? Thank you, gang. We are at item 3, Madam Clerk, if you would read.
Yes, item 3 is a presentation on the cold weather emergency shelter and.
All right, we are at item 3. Ms. Beck.
Thank you very much. So cold weather shelter, we spoke about it last time, but it's about that time of year actually where our office, the Office of Care Coordination, starts the process for planning to support an upcoming cold weather shelter, looking at this upcoming cold weather season. With the feedback and challenges we've had over the last few years, we being the county, specifically my office, the Office of Care, including our process last year and rolling out an RFP back to that funds and to the journey that took place to get Fullerton. We're really interested in having the commission be a key partner in determining the need and design of a potential cold weather shelter. In order to start that discussion, I want to set the table and provide some key background and information about the history of the cold weather shelter here in Orange County. So in the winter of 1987, the governor authorized the California National Guard to make armories available for the use of temporary shelter. Here in Orange County, we didn't open our Santa Ana and Fullerton armories to 2006. And that was really a result of us as a county working with the National Guard to identify which armories were suitable for temporary shelter, the use of the cold weather shelter. Which resulted obviously in, let's see, is my clicker on here? There we go. Which resulted in the National Guard coming back and really identifying Fullerton and Santa Ana armories as the only armories in Orange County that were suitable for this particular usage. I want to spend a second in just giving a little bit of background in the traditional operational model here. So as many of you know that the cold weather shelters historically served adults only, providing a place for people to stay overnight. During the cold weather, specifically during the cold weather months. And it's always been a first come, first serve model each night. So not guaranteeing a bed to someone who has stayed there prior just because they've stayed there prior. Historically, we've always had a shuttle service to and from specific drop-off locations. But prior to 2017, the facilities, I'll call them the shelters, had a more open and free stance around walk up and walk out. Where in the last several years, out of consideration for the cities it's been located in and requests by the cities it's been located in, we've really focused on not having a walk up or walk out shelter, but really providing shuttle service to and from specific pickup and drop off locations. We've always provided a warm dinner, bag breakfast, and access to showers, restrooms, and other, basic services. In more recent years, there's been a considerable enhancement. First, that's not mentioned on this slide that I think is important is we've moved away from having mats on the floor as the bed to raised cots. By no means is this, the greatest accommodation, but moving from a mat to a cot is definitely moving in a much more humane direction.
How does that affect How does, okay, I've been there many times when there's mats and now you have Scott. I agree with you, but you got to break down the Salvation Army by 6 o'clock in the morning. So how does changing the bedding impact the ability to provide and be efficient, right?
So I'll get to that because the need to break down the bedding has depended on the particular location. For example, this year at Fullerton, they provided us access to that site 24/7. We did not have to break down the bedding each day. When we were at the last year, we were at the Salvation Army, not the Salvation, the Santa Ana Armory. Our provider was able to just fold up the cots and store them. So.
Yeah, but the reason I ask is because there was an old way of doing it and we had winter shelters. We had Santa Ana simultaneously operating with Fullerton and we had mats. So I'm just, so I appreciate your answer. You're telling me what's happening today. My question is, I don't want to repeat what happened last year where we didn't have a cold winter shelter. So quite frankly, if you told me in order to have one, we have to have mats, I would say, put the mats down and let's open the cold winter. So that's more of my question, which is anybody indicating that would be an inhibition to doing it at all?
The mats have not, that change has not come into play at all. We haven't, part of me almost wishes we were at that point in some discussions where that would be the only thing that people said no to. But no, that hasn't been a deterrent to our operations or the willingness of a city or facility to work with us. So additionally, and I'll get to our site location and some of the variables in it and how that's changed over time in a minute. But I also want to mention as well, in the last couple of years, really in the last 5 to 6 years, we've ensured that there's case management services at our cold weather shelter. And the reason that's important is a couple of things. There has been a narrative that this is a warehousing effort that is just basically, you know, an open facility that people can come in it early in the evening, leave early in the morning, and we've done nothing to improve their situation. We've spent a lot of time and effort, not only working with the provider to ensure that there's case management at the site, but working with the departments here in the county to ensure that, you know, access to benefits or mental health services, really access to referrals, because we know on the overnight, most of these resources are not open. But SSA, HCA, OCCR have been incredibly resourceful in making sure that they've used this as an opportunity to ensure that folks get access to their resources. What it's resulted in, one of the things that it's resulted in, which I think is important, is that over the last 2 years, 185 people who have come into the cold weather shelter have utilized that opportunity to access more permanent either shelter or permanent housing. So it has been a foot in the door for a lot of folks. And it's important because what we're seeing each year at the cold weather shelter is that, you know, there's 2 very specific groups that we see when come into the shelter. One is folks that we don't see throughout our system any other time of year. So this is an opportunity. This is the one chance we have to display our system of care and hopefully engage them into services. And then the second is a group that we have seen that has historically said no thank you. And this is another time to offer them services in another way. And like so many of us, our interests change at time, and we want to make sure that whenever we're engaging folks, we're giving them the opportunity to access long-term stabilizing services that hopefully get them out of homelessness and get them stabilized. Obviously, an important factor to the story is location. So here we provide an overview of the different locations, operators, capacity of the cold weather shelter over the recent years. Obviously, COVID played a big role in these changes, but also the ability to find a facility and a city to agree to cite that location has been challenging. As you can see here, we have had variation in every criteria I've listed. So pre-COVID, we had consistency at the Santa Ana Armory and at Fullerton. As folks have asked before, Fullerton, there was a plan for Fullerton Armory or the Fullerton Cold Weather Shelter to be replaced by bridges and for it to close when bridges opened. The city of Fullerton actually requested that we keep going with the Fullerton Armory at that time. So you can see that through COVID, we had the Fullerton Armory. COVID hit, COVID hit and the armories were activated and we transitioned into the Salvation Army storefront. Although CityNet was the provider, I just want to make that clear because that's often a misnomer that Salvation Army was the operator during that time. And we were in Independence Gymnasium or Park in Fullerton for a short period of time. That operated through the summer of 2020 and I believe 2021. And we landed back in the winter of 2021 to 2022 at the Santa Ana Armory. VOA was our provider. And due to COVID restrictions, we were at 85. And then as we all know, last year we put out an RFP. We didn't hear back. Salvation Army was interested and willing to utilize their hospitality house here in Santa Ana. The city didn't, the city didn't agree with that. So we moved, and Fullerton around Christmas time, and our commissioner Bob Dunn, who unfortunately can't be here for a personal reason, offered the access to the city of Fullerton's Independence Park Gymnasium, which was 110, has a capacity of 110. So worth also noting when setting the table here is it's important, I believe, and is to remember that our system has added since 2017 over 1,300 additional year-round shelter beds, specifically funded by the county. That doesn't include city-operated shelters, some city-operated shelters and private shelters that came on board as well. Obviously, the importance of that is that when the first roughly 10 years of operating the cold weather shelter, there was little to no year-round shelter for folks to utilize. So the cold weather shelter was really the only place or time folks could get shelter. We now have, obviously a significant amount of shelter, year-round shelter beds, and then which changes necessarily the need or the purpose of the cold weather shelter. And I want to make sure that that's noted, that the landscape truly has changed here.
Well, you need to quantify that. We're not qualified. What are you saying exactly? Because the inference is the demand isn't as great. And we knew that there were people sleeping on the street when we had no place to put them at night, who were dying or getting sick. And I think it's Reverend Fritz, I may have his name wrong. He puts out the death list every single year of people who die. So as you know, I got pretty animated and pretty upset about what was happening with the Salvation Army in the city of Santa Ana. I didn't hide or pull any of my punches. I do believe, I didn't look at it or quantify it, but there has to be a relationship between the number of deaths on our street during that cold winter. It was colder than anything at that time that we've experienced a long time. And the fact we didn't have a place to put people. So just at least put a little bit of a buffer on what you just said. We still have a need for
So I want to be
high
clear.
risk population.
So the reason I put this slide in here is, I think, I know, is because often the narrative is that if we don't have a cold weather shelter, there is nothing else going on in the county. And we're sort of leaving people hanging. The need now that I would say is, I look at the over 1,300 beds we have year round, and I say, and compare that to the very few we had prior to that. The key difference, I think, in obviously our year-round shelter, which shows that we've made investments in helping people, and our cold weather shelter is that our cold weather shelter is a place people can go immediately when we're in this season. They don't have to wait on a potential wait list. It's first come, first serve, which is a very important, a very important access. What I'm trying to do is provide context here that the cold weather shelter is no longer the only thing we do. And if we don't do it, we have nothing else. I'm not suggesting that we don't do it. But I am suggesting that, hey, listen, the narrative that's sometimes put out there that if we don't do the cold weather shelter, we're just, basically hanging up shop and doing nothing for the winter. We've invested tremendously in our system. And I think that's the important piece to this. Around the death data, that's something we could talk about.
I only brought, maybe I should know because I wasn't trying to open up another door.
Yeah.
But I'm a professional trained listener for a living, and I still need an answer. Do you believe, even with the additional 1,300 beds year round, that as part of our strategy to help people who are in that particular condition, that we need the winter shelters?
I think that, so as in my position, yes, I think more capacity is better capacity. I think that the challenge, the operational challenge that we have is citing a location. And what I'm coming back to this commission for and interested in the input, because we have, so many folks from different angles here that relate to the cold weather shelter, is trying to understand what would be the best model to move forward. What I do want to mention that relates to, I believe, what you're asking here and what I'm trying to shoot for is we, in the last month, me and Frank Kim, our CEO, as most of you guys know, met with Chief Dunn and City Manager Eric Levitt of Fullerton to debrief further about the cold weather shelter. And their feedback was it operated well. They're proud they did it. But one of the challenges that they see, and we've heard it before from other cities, is that they're seeing people out on their street that are solely there because of the cold weather shelter, post cold weather shelter. They said the operations were smooth, PATH did a good job. They weren't seeing a large community impact or really any community impact when it was in operations, but they cannot ignore that there are people on their streets that weren't there before. And they know through the data that people throughout Orange County utilized this shelter. So they have asked us to explore additional models to potentially look at if Bob Dunn were here, I know he would say several different locations or micro units. There is, I don't want to totally open up and dive totally down this rabbit hole at the moment, but there are pros and cons to each one of these models. I, to answer your question, believe that we need cold weather shelter here in Orange County. It is an important resource. And I'd argue the most important piece of that resource is the 185 people that moved on to more long-term housing that really had, this was their foot in the door to truly start addressing their homelessness. I want to quickly go over some challenges and opportunities, and then I'm going to hand it back over to the chair. So challenges, the purpose of all of these slides is to really just set the table, provide the context, and make sure that as whatever discussion we have here or in the future is as informed as possible. So some of the challenges we have is the quick ramp up and ramp down of a shelter. It takes considerable energy and cost and resources to get a site, especially when the site moves from, an armory to, gymnasium to another location to get it ramped up and ramped down. Obviously, the hours of operations being on the overnight are difficult for a variety of reasons, but very much so for staffing. We hear our providers mention that challenge. We've talked about the facility's location and capacity to accommodate some of the needs. Also evident back in 2006 when the National Guard vetted their armories, noting that not every armory was a possibility. Capacity, we've seen capacity across our system vary. This year, as we've seen on the slide, Fullerton started as a 90 capacity. They went up to 117 almost every night for the last month there. But ensuring that we have enough capacity is always challenging. And then funding. I didn't mention funding, but each year the county leverages different state and federal funding to fund the cold weather shelter. This isn't a mandated service. It's also not a service that we get a direct funding stream for. This is something that we have to really, like we do, we braid it every year from different funding sources to make sure we're able to do it. Obviously, the opportunities are increased shelter capacity, engaging, like I said, people that we historically don't engage other than in that, and providing extreme weather, including rain, wind, and frigid temperature relief each year. So the goal was to set the table and to inform the group. Not only we all know about the location challenges, but really what the cold weather shelter fully entails. With that being said, I will cede the floor over to the chairman.
Thank you. And I have Commissioner Sarmiento. We'll open it back up to anybody here, and I have a couple of comments. Sir.
Yes, thank you, Chair, and thanks, Doug, for presenting the issue, just because I think the range from what we're talking about is sometime in Thanksgiving goes to like mid-April or September. So it'll be upon us before we know it. Just because we don't meet as often, and we do need to start considering options and decisions. So I appreciate Todd's comment, and I think it's an important thing. I think there is a relationship between inclement weather on the street. I don't even want to open the can of worms of saying, there could be extreme heat conditions that could cause that. So then we're talking about, another source of harm that could, befall people who are unhoused. So the idea of, micro locations and other possible solutions or siting a place. And I see that, since 2017, Santa Ana has been part of it, with the exception of last year that Fullerton, agreed to house the cold weather shelter. But I guess my sort of what I didn't know, and what was really helpful in this was I guess it was a California National Guard sort of told us that we should have the armories available to this. So that's how it happened, right? That's how we started down this path of saying, let's start activating the armories. So, that's not really the case. We're not bound to do that anymore. We just have to find a shelter in space whether we're going to use cots, whether we're going to use beds, but it doesn't have to be limited any longer to any, armory. So I think this is something that the concern when I was mayor in Santa Ana, and I made no bones about it either, that Santa Ana had been offering the cold weather shelter and been the host city since it started. But there are impacts, just like Fullerton, Bob could mention, and and their city manager and council members from Fullerton have mentioned to me as well. They were the same impacts that I observed as mayor and councilman. So to the extent that this is a necessary remedy that we need to provide, or a resource that we need to provide during cold weather, the idea is, how do we do it? Should it be shared? Should it be a responsibility borne by only 2 cities? Should it be a responsibility borne by only 1 city? That's the question. I think we have so many different issues to consider on this, and I'm really glad that we have a network now that we didn't have of beds. And I know one of the things that I recall when the whole discussion of the shelter, of the cold weather shelter, was being talked about was there was a lot of vacancies at some of the network of the shelters that we had. So we even talked about how can we all agree as a network of shelter providers in cities? How do we lower the barrier during those times where you don't deny anybody a bed when they're trying to get inside? And, some shelters have different rules than others. Some are very high barrier, some are, some are mid-tier. So to the extent that we can make those available in that capacity, there should never be an empty bed if somebody needs it, especially during conditions like this. I would, Mr. Chair, just for those of us, I think that, all of us, I think on this commission, this is a deep dive into something that we should provide. Maybe there's an ad hoc that you might want to consider, for us to, a subset of us just to do a deep dive, bring back some, some recommendations or considerations for the larger commission to think about. But I just wanted to put that out there.
Thank you. Let me address that real quick. I think you were looking over my shoulder because Doug and I have talked about it. Maybe you've had the opportunity. It does suggest itself that there is an ad hoc to deal with some of these issues, the siting, the number of shelters, the conditions under which they're open, barriers, et cetera. And so I like that idea and was going to propose it myself. You beat me. Thank you.
You can take ownership.
No, you're going to be on it. Count on it. So anyway, so we will come to that in a minute. I saw a hand over. It was at Commissioner Fawn.
Two of the names on the list were infants. Something we didn't talk about here, and maybe this is something that could be addressed by the ad hoc as well, is these are shelters for the cold shelters for individuals. But we haven't said anything about kids or families. Grand jury report identified 23,000 McKinney-Vento kids in Orange County. And, maybe I'm just not familiar what the emergency system is for kids, but I would hate to see, in this coming winter, another list that has infants dying in the street. So I just want to bring that up because we don't want to forget to address that as well.
Just real quickly, to respond to that, I'm sorry. Absolutely. I haven't had a conversation with our housing division around a similar issue. Are we seeing kids or unaccompanied youth out on the street? And what I was told, and from my experience in my seat, it is very few and far between. And when our system does come across that, especially in these times, it's a really all hands on deck approach to make sure that we get children indoors immediately.
I wouldn't, unaccompanied kids, probably not going to see a lot, right? But there are, we talked about single moms earlier. There are people sleeping in cars, right? And still exposed to the cold.
Yeah, just to be clarified, I'm talking about both of those populations.
Thank you. I saw Commissioner Wyatt and then Commissioner Spitzer.
I have a question for Doug back. He mentioned that there were two specific segments of the homeless that we saw in cold weather shelters that we didn't normally engage with. And I was curious as we look through this, why that is, because as we change the way they operate, we have to make sure we don't cut them back out again if they're not willing. So.
Yeah, I think that's more of a statement than a question, but I appreciate the sentiment.
Well, I was just curious as to what was different with the cold weather shelter that they would go and they wouldn't go to a regular shelter in cold weather.
Well, it's interesting because we put a tremendous amount of energy since it was such a short cold weather shelter this year. And we had a really rough weather season past March 31st to engage as many of them to go into services, whether we had an opportunity for them that day or further. And a decent amount of folks said, no, thank you. We'll see you next year. So I think it's a mixture of folks that are newly homeless, folks that sort of stay off the radar, and then folks that it's a good opportunity for them to come in. To your point, I think that what we cannot lose in our model of the cold weather shelter is that immediate access, because then it just turns into a year-round shelter, and it takes away from one of the most important values of a seasonal shelter.
This is they're turning down year-round shelter. They're showing cold weather shelter. We have to ensure that whatever that barrier is.
We don't let that.
And there's an ability, there's something we hear from not all folks, but they like the ability to just come in. Or, out of the street during bad weather, get a meal, get a bed, and go back out onto the street, sort of low barrier, low interaction. And that's okay. I mean, we'd ideally hope that they'd engage with more services, but we're not going to discourage that by,
Mr. Chair, so just a couple points on different issues. To me, the inventory is not just the county inventory, it's the cities as well. The city of Orange, I was at the grand opening, I live in the city. To Jack's point, I mean, they keep families together, so their shelter is a family shelter. So, if they have capacity, I agree, during an urgent time, there needs to be an agreement amongst all the cities that we're gonna reduce the barrier so that every single bed or beds are available. In terms of the ad hoc, the city managers need to take the lead, in my opinion. We have the representation. The city managers really are the ones that have the expertise and the relationships. They're the ones that are going to understand from their chiefs who they appoint what issues are coming up from a law enforcement point of view. And quite frankly, the city managers need to help us with the solution with the electeds on how to spread these throughout the county, which we still don't have equal representation. And that, I mean, Christine's here. I mean, she was a city manager in Laguna Niguel, and one of the big things is what's South County doing to contribute, right? So I would, and the other thing is on this chart on challenges, I think you have a duty to add that what you just raised, which I had never heard, which is what are the clients doing after the closure? They're remaining in the area, I guess, according to the chief in Fullerton. I get it, but they relocated and now they're causing issues, I guess, for law enforcement. So I would just urge the representatives who are here as city managers be put on the ad hoc and have a conversation about how we're going to deal with this. Because if we end up with stalemate and we have capacity, we are literally going to be in the same position we were last year. And that's not acceptable. Oh, lastly, sorry. You asked me, Mr. Chairman, about if I had talked to the courts about doing a court at the shelter. So in other words, a lot of these individuals who are going into the shelters have open cases, warrants, tickets,
We had a
whatever.
discussion a couple of meetings ago.
Yeah, and you pointed back at me and said, well, what have you done? I raised it. You said, what did you do to advance the conversation? And the answer to that is Judge Cooper is in charge at this time of the collaborative courts. I don't know if you all know the Superior Court has 18 vacancies. They're the chairman, sure, he knows, because he hears about it every night, I'm sure, but from his wife. But the fact is they'd like to partner with us on something like that, but they're really short on magistrates. So Doug, I think we should start engaging in conversations, because if you can let people know we can incentivize you to take care of your warrants, your tickets, we can package that up and clear you out. I think you might actually incentivize people to come to the shelters if they know we're going to do that. And if they show up, they can't be arrested. So like if they have a warrant, we're not going to hook them up because they came in. So we promise them that, unless if it's for minor infractions, if they come in with a murder warrant, that's a whole different conversation. But my point being, I think we could use this time on their cots to actually get some work done.
Yeah, I think two things. I agree. There's a way, in principle, I know the operation is very difficult, and that's something I think we need to engage OCC, JCC with around this particular solution and bring them into the discussion. But I also think there's the principle of it. There's a way to have that opportunity there that doesn't scare folks away, because they're not going to get arrested. This isn't like a roundup. opportunity, but I know that OCC JCC plays really a big role in this, and I'll bring that back to
Put on the agenda.
Lily and Michelle on that.
Perfect. Thank you, Mr.
Yeah, for what it's worth, the need for bench officers is just amazing in this court system. Incredible how understaffed they are. Commissioner Morris.
Well, as I believe the only person who's ever been to a cold weather shelter.
Not true.
You-
Maybe you stayed there, but
I
a lot of us
stayed
have
there.
been there.
I stayed there as a client.
Right.
Yeah.
That's
I-
true. I agree.
I am certainly willing to join the ad hoc on this.
Okay. And I do think that it does warrant further look and a deeper dive with an ad hoc. I would agree also the issue of city managers, the electeds, to the extent, that we supposedly, and I think do have our ears to the grounds for our communities and what's possible, what's not, and maybe a bit of a bully pulpit to cajole. And so I would think that would be exactly why Commissioner Sarmiento is going to be on it. But anyway, any pushback, anything further, and Commissioner Morris, thank you for your volunteering. Anything further on the idea of an ad hoc? Do we need action on that, or is that just, we will get it done? All right, that is coming. Anything else on this particular issue? We are going to move on. It is getting late. We are at item 4. Madam Clerk, if you would read.
Item 4, which is the commitment to adherence to minutes from April 19th, 2023 meeting. And then no questions on the
Say any problems with the minutes? All right, all in favor, say aye.
Aye.
Any opposition? Any abstentions? Carries unanimously. Item 5, Madam Clerk, please.
Item 5 is membership recommendations to recommend the appointment of Christine Ridge, city manager for St. John, to serve as the Central Service Planning Area Representative on the Commission to End Homelessness, to the Board of Supervisors for final approval for the balance of the term, August 9th, 2022 to August 8th, 2024. And to approve the launch of the recruitment process and utilize the existing membership ad hoc committee to evaluate and make recommendations for appointments or reappointments to the commission. To be submitted to the Board of Supervisors for approval. The vacant and expiring membership seats that will be particularly included are people police and the city, for the housing development industry representative, city manager or elected official in the North Service Planning Area, faith-based community representative, and 1 ad hoc member. We have 1 request from the public to speak on this item. Christine Rich from the city of Manhattan.
Don't talk us out of it.
And I can't talk. Just get after your commissioners. I just want to express my appreciation. And it's awesome. I have the in North Central.
Well, I was going to say that she's been mentioned a lot, can obviously bring a lot to this commission, and this will probably be the last time that she says nothing sitting through a commission meeting. But she couldn't even do that. I am certain this is going to go well for you. Let me turn it over to Mr. Beck for the entire item.
Yeah, real quickly, I just want to take a second to walk through the process for the recruitment for the next set of seats. The membership ad hoc recruitment will open July 1st. From July 1st to August 31st, which gives us 2 months. These seats expire, I believe, in October. So this provides us a good amount of time to recruit for each seat and make sure candidates are aware of it. We also know the summertime, we're all on vacation at different times. We want to make sure that we catch folks. Candidate applications will be reviewed by the existing membership ad hoc between September and October 17th. We'll recommend the candidates for the vacant seats, expiring seats in our October meeting. We'll bring it to the board in November, and then our December meeting, barring any significant changes, we'll be able to seat all of these folks. So we'll have no gap in representation.
All right, questions, comments from anybody? Do you need an action item on either Ms. Ridge or the? All right, I will entertain a motion.
I'll move the item.
And a second from Commissioner Davis. All right, all in favor?
Aye.
Any opposition? Any abstentions? Congratulations, Christine. Welcome aboard. And we have our process for membership recruitment. All right, we are at public comments. Madam Clerk.
Yes, we have 2 requests to speak.
All right, please call the speakers.
Our first speaker is David Gillanders from Pathways of Hope.
Good afternoon. Thanks very much. Interesting conversation today regarding rental assistance and prevention and things like that. As a organization that provided the ERA funding for the north portion of the county, we found prevention to be extremely successful, and we appreciated that effort and that commitment by the county to do that work. A lot of success keeping people in their housing, which brings me up to something else I wanted to discuss briefly, which is lost a little bit in this conversation. I appreciate Jack's bringing it up, was the mention of families. Well, our mission as a service provider is to help anybody who's homeless. We feel like the family conversation has been lost a little bit in some of this topic, in this topic of shelter. And the primary reason that we think it's important is because right now, if you're a family who is unhoused or homeless, there's a good chance you are going to be waiting up to 6 months just to get a shelter bed. And the number of families that are currently on that list waiting for shelter openings is approaching 100. So that means we have maybe as many as 400, 450, 500 people who are living in places probably not meant for human habitation, potentially cars, because of the economic backslide we discussed earlier that gets people into homelessness to begin with, right? We have these people, these folks, these families, these children, not in shelter, and obviously not in a productive way towards permanent housing, which brings me to my other point. One of the reasons we are seeing this impact in Pathways of Hope, I'm not here to tout our success, but we are the largest provider of county-funded shelter beds for families in North Orange County. One of the reasons we are having this problem, and I found the conversation earlier about landlords interesting, is because we see an overwhelming amount of people who are carrying Section 8 housing choice vouchers and emergency housing vouchers that cannot rent. They cannot find someone that will rent to them. Now, there's a number of reasons for this, but most directly, and the thing that we get the most feedback directly from the clients about, is they would not rent to me because I have a Section 8 voucher, which is a discriminatory practice and illegal, but it is happening. That backlog or that inconsistent ability of families to rent successfully once they have that golden ticket voucher creates a backlog, which then jams shelter beds and creates a lot of problems on the front end and keeps families homeless longer. It's a very similar problem on the single side. The problem is on the family side is, quite frankly, the number of beds is inadequate given the need, which you could argue it is on the single side too. But as Doug mentioned, there's been a lot of investment infrastructure, and I think that's great. But on the family side, we are still seeing a big struggle with that. So I wanted to put that out there for everyone's consumption. 2 shorter points. I would strongly suggest not just breezing through the UCSF study. I would take the time to read the executive summary. I would get to know it. The things in it and the details in it about the people we serve, the people who are homeless, the facts are staggering, and they will change a lot of people's minds if they take the time to consume it and consider it valid. The fact that 90% of the people who are homeless here are from here should be enough to change someone's perspective on the problem we're dealing with. 1 minute? Oh, come on, I have one more point.
Real quick.
Really quick. The conversation around shelter, around armory. I have not thought in the 15 years I've been doing this work that it is particularly fair for only certain cities to bear that burden. So I appreciate the effort that I heard to appoint an ad hoc committee that contains representatives of other cities, because I do think not even 2 armories is enough. We need more than that.
Thank you very much. Next speaker, please.
The next speaker is Carrie Buck from Family Solutions Collaborative.
Afternoon. I just wanted to introduce myself. My name is Carrie Buck. I'm the new executive director for the Family Solutions Collaborative that was mentioned. For the last almost 10 years, I've been a service provider, shelter provider for formerly his house, for his OC now. And I just wanted to highlight, thank you, Commissioner Twan, for talking about families as well, and also Mr. Galanders. The Family Solutions Collaborative formed in 2013 as a grassroots coalition to help address a homeless response system for families. We're comprised of 24 of the leading family organizations in Orange County, working to prevent, divert, and house homeless families in a prompt, coordinated, and equitable effort. We manage the family coordinated entry system, match meetings, access points, bed reservation system, and many other projects. In an effort to ensure system-wide best practices for families in Orange County, the FSC focus and goals are to ensure that families are, have the access to family shelters, prevention and diversion services, as mentioned before, as well as housing resources in an equitable, timely, and coordinated manner. I look forward to working with all of you and those of you that are not engaged with the FSC yet. And I plan to attend regularly so that I can update you and report you on our progress and success. Thank you very much.
Thank you.
I don't have. I gave it to her. Rebecca Kovac-Stein speaking on the cold winter shelter.
All right.
Thank
You
you.
go. Okay.
All right. Based on my experience as a homeless and housing advocate since 2017, not all cold winter shelter folks are full-time homeless, street homeless. They are circulating in and out of navigation centers. And this is based on my experience, Todd. I'm out there with belly to belly with issue. I also wanted to say that cold winter shelters do save lives. I also wanted to say that not all listed on Father Dennis's homeless death list were homeless at the time of deaths. However, due to no funds for afterlife care, they ended up on the coroner's list. And I can say this, one of my girls was housed and there was no funding for her afterlife care. So my husband and I stepped up to prevent her from being on that coroner's list. So I know that from experience. And I think an ad hoc committee could collaborate with some cold winter shelter staffers for suggestions on improvement for future cold winter shelters. And I do want to say that Pat did an excellent job in Fullerton. And I did notice that they added services like weekly and they were open to various donations brought in by advocates. So it was a really good experience. Thank you.
Thank you very much. All right. Seeing no further public comments, let me bring it back here. Commissioner comments. Anyone? Ms. Rose.
Thank you. I could just like to share with
Commissioner.
Can be on June 28th at the Lakeland Community Center. We're going to be giving an update on Tier 4, what can be there to show that kind of things. We'll have a short session on information specific to the forest. And then it's an opportunity for our residents to meet all the service providers that are available. This one, hoping to be a lot of there. We have a lot of attached people in our area that actually. This is a way to match it up with service providers so they understand what resources.
Again, that's next Wednesday from 6 to 8.
Thank you, Commissioner Rose. Anyone else? All right, folks, that concludes the meeting for the day. We will meet again on Wednesday, August 16, 2023 at 1 o'clock. Thank you all. We stand adjourned. What can I do for you? Okay. Good to see you.
Gone.